this Tribals Welfare Junior Degree College in Etunagram. And my work as a nephrologist is to prevent kidney disease. After a problem comes, it may be treated or may not be treated. It is not in our hands, it's in God's hand. Even if you do the best treatment, still people die. There is no guarantee of any medicine in this world. But there is definitely a guarantee that you can prevent a problem. If you jump from the mountain, there is a high chance that you will break your bones. Whether that bone will become normal or not, there is no guarantee. But if you don't jump, there is a guarantee nothing will happen to your bones. So the same logic applies to kidney disease. For not just kidney, any disease, you may become tomorrow an IAS officer, or maybe tomorrow you may become the chief minister of the state, or maybe tomorrow you may become any decision making power of any level. But the most important wealth which you have is health. And health is not just physical well being, it is physical, emotional, and social well being. So, among the physical well being in our body, there are five vital organs. How many there are? Five. Without which there is no life. If one organ is not there, there is no life. So, these five vital organs, starting from the top, it is the brain. No brain, no life. No heart, no life. No lungs, no life. No liver, no life. Similarly, no kidneys, there is no life. So, kidney is a very, very important vital organ. And Sai does 250 dialysis per month, but there is not a treatment. Treatment means it's like typhoid. Typhoid has come, you have taken 5 days antibiotic, typhoid has gone. Now there is no more typhoid. But dialysis is not like that. Today you do a dialysis, day after tomorrow again a dialysis, after 3 days again a dialysis, after 5 days again a dialysis. Ultimately that dialysis makes the person weaker day by day and survival decreases. So the aim is to prevent dialysis, to make India free from dialysis, because dialysis is not a cure, it's not a treatment, it is just maintenance. So our work is how to prevent kidney disease. And to prevent kidney disease, there are 8 golden rules. How many there are? 8 golden rules. This I will ask you all after the end of this talk. So try to remember. First is drinking enough water. This is the first golden rule. Drinking adequate. Male, female may be different. Children, adult may be different. Hence, the answer to this question is we should drink as much water that our urine is white in color. What should be the color of the urine? White. If the urine is white in color, that means you are well hydrated. You are having sufficient oil in the engine. Your body is working properly. Like in our car, bike, and anything, you put some oil or petrol or diesel or kerosene. Same thing in our body. What is required? Water. Very nice. Oh, smart girls. You require water. So water is the essence of life. And the more the water, the better. There is nothing called overhydration. If you drink 7, 8 liters, something will happen. Nothing will happen. Your body will manage. But if you take less water, then the kidneys will start to save water. Recently, just today morning, I went to a waterfalls here for the Kongala waterfalls. There is no water. Then I went to Bogota waterfalls. There is no water. So what the government is doing? They are digging holes over there, big holes. Why? To conserve water. Similarly, if you drink water, what the kidney will do, it will try to conserve water. It will try to conserve by making kidney cysts, by making kidney stones, and by making urine very concentrated. You will have burning sensation while passing urine. All those problems will come because kidney is trying to conserve water. So conserving water for kidneys is not a good idea. So white color is normal. If it goes to mild yellow, it's okay. It's okay. Orangish, dark yellowish, reddish, it is burning one down in the urine. That's dangerous. That means you will get a urine infection someday. You will get a kidney stone someday. Someday your kidney might stop working also. It's so dangerous. So we should be very careful about water intake, and we should drink at least that. In an AC room, you may require only 2 liters. It may differ. And the technique of drinking water is important. It is not like drinking those drinks, that after मॉर्निंग व्हाट ड्रिंक साई किधर है साई वो क्या ड्रिंक था मॉर्निंग में पाम कल्लू नीरा इट इज नॉट लाइक नीरा आफ्टर ड्रिंकिंग नीरा पूरा आउट हो जा रहे हैं ऐसा इट इज नॉट लाइक बियर पी के पूरे को so drinking water is supposed to be it's worship it's holy so we should drink only 500 ml in one time then wait for it to get absorbed. Very cold water will not go in your blood. The temperature of our body is 37 degree Celsius. And if you drink very cold water, it will not go in your blood. The body has to warm it. Then it will go in your blood. If you drink very warm water, 45, 50, 70 degree, it will still not go in your blood. It has to get cooled down. Then body will absorb it. So drinking normal temperature water, room temperature water is important, and drinking 500 ml in one time is also important. If you drink lot of water, you may have acidity or vomiting issues may happen. Drinking less water is also dangerous. So this is the first golden rule. What is the first rule? Drinking enough water, staying hydrated. Drinking enough water is important. That is the number one golden rule. Number two golden rule is eating fresh food. Eating fresh food. Because whatever we eat becomes part of our body. If you eat stored items from the fridge after 8 months frying and eating, then it is a very difficult task for the body to make it alive. Eating fresh food is important. Fresh food has water. Fresh food has minerals. Fresh food has vitamins. Fresh food makes you fresh. You will do fresh things in life. So fresh food is important. It should be fresh from the field. You are very lucky to be in such a beautiful place, Etunagram, where you are able to get free. In Hyderabad, it's a big difficult issue. The air is also polluted. Difficult to breathe also sometimes. I feel what's going on. So coming to this place has made me so happy. So eating fresh food is important. And eating little bit low protein diet is important. A high protein diet means eating 3 times mutton. Hyderabadis eat like that, from morning till night. Morning till night, only non-veg. It's not good. I think one time is enough. So eating more of fresh food, less of protein is important for a healthy life. So this is the rule number 2, eating fresh food. Number 3 is exercise. Exercise at least 30 minutes. Exercise doesn't mean my school is so big, my college is so big, my hospital is so big that I have to walk till there. That's my exercise. That's not like that. It doesn't work like that. Exercise means you should have that heart rate. Your heartbeat should increase at a certain level, and it should be there for some time. And the target is 220 minus your age. What's your age, madam? Sorry, it's a very personal question. Anyway, whatever your age is, 220 minus age, that much your heart rate should go. That is the target. If you reach that number, that means that you're doing a good workout. You're doing a good workout. Because run on a treadmill till the heart rate reaches that number. That is called zone 5. 220 minus age. So if you are 20 years, your heart rate can go till 200. You should touch that number once a day at least. That will make sure that your engine is okay. That you will be able to beat it faster. So number 3 is exercise 30 minutes per day minimum, or you can walk at least 10,000 steps per day. Most of the mobile phones have this capability to tell you how many steps you're walking. 10,000 steps per day at one sitting is important. Number 4 rule is avoiding addictions. Addictions doesn't mean cigarette, alcohol, zarda, gutka, all those things. There is a biggest addiction of cool drinks, soft drinks like Pepsi, Thumbs Up, Coca-Cola, Sprite, Fanta. All these soft drinks is the biggest addiction of this century. Everyone drinks it. And if I don't drink, it burns. Arey, something is happening to my chest. These soft drinks will cause serious problems. They increase the risk of diabetes. They increase the risk of kidney stones. They make you weak in the long run. They make your bones weak. So avoid soft drinks. It's very important. Soft drinks is a cause of kidney disease also. In our state, maybe in this area also, but in Andhra Pradesh there is an area called Uddanam. In that area, almost every house, one person has a kidney failure. And the cause was found to be this use of soft drinks and pesticides in the farming areas. So the moment you get tired, drinking soda, drinking cool drink is dangerous for kidneys. So fourth point is avoiding addictions, and the biggest addiction is cool drinks. No cool drinks. Eat fresh food, fruit juices is okay, but no cool drinks. Please, strictly no cool drinks. Fifth golden rule is avoid use of painkillers. If you are coming to college, studying from morning till night, then going home, and then again doing some work over there, sleeping late, waking up early in the morning, and you get tired, you get a headache. The treatment for that is rest. You have to sleep. If you sleep for more time or 6 to 8 hours per day, that headache will go, your muscle pains will go. But short term success, no sir, tomorrow exam is there, I need fast. Doctor sir, doctor is giving one injection, painkiller, then one tablet written for 3 days, but that person is taking the tablet for 3 years, every day habit. Painkiller, headache on the painkiller, headache, painkiller, mood is not good, painkiller, food is not good, painkiller, teacher scolded me, painkiller, boyfriend left me, painkiller. So, all these painkillers, that is not the answer for the pain of the heart. You have to solve it in a separate way. So the heart pain is different, but painkillers damage kidney. They are the world's number 3 cause because of which people reach dialysis, and it can be prevented. 100% preventable. 100% preventable. Use of painkillers is dangerous. They reduce the pain spontaneously, but put the load on the kidneys, and the kidneys become weak. So avoid painkillers. Rule number 6, control blood pressure. Blood pressure anybody can get at any age. But remember, if anyone has high blood pressure and that has been detected below the age of 30 years, that means there is some kidney problem. We have to diagnose and treat it. If anyone has got blood pressure during pregnancy, that means there is some kidney problem. We have to diagnose and treat it. If anybody has blood pressure not being kept under control, that means they will get a kidney disease someday. That has to be diagnosed and controlled properly. So world's number 2 reason because of which people reach a dialysis machine and need a new kidney transplant is uncontrolled blood pressure. Rule number 7 is control blood sugars. If your blood sugars are under control, then there is a very, very less chance to get a paralysis attack, heart attack, kidney failure, very less chance of getting your foot cut by a surgeon. You must have seen people because of diabetes, one finger is cut, one leg is cut. So all these things happen because of uncontrolled sugar. High blood pressure, high sugars have no symptoms. When the symptoms comes, it's very late. It's important to check it every year. Once on our birthday, we should check whether we have blood pressure or sugar. It's free. Hospital is next door. You can just go and check it. Once a year is enough. Once a year. If you are at risk, for example, mommy, daddy has some kidney problem, brother has some kidney problem, then you can check twice a year. Otherwise, once a year is enough. And the last golden rule, the 8th one is we should always check our kidneys also. Like madam will give you your report card whether you have passed or failed. Similarly, there is something called as a kidney report card. Kidney report card consists of three tests. The first test is how clean the blood is, the function of the kidney. The name of the test is serum creatinine. The moment you do a serum creatinine, there is an online formula. Put it in that formula CKD EPI, you will get the GFR. How much kidney is working in 24 hours? You will get to know how much percentage. Normally, it works 100%. So if it goes below 60%, that means your kidney is failing. Be careful. Checking creatinine or GFR is important. It's a very simple test. 50-60 rupees it takes. Second test is urine. This is the function of kidney. Second is the filter of the kidney, how the kidney is filtering. A simple urine test will give us enormous information, whether there is protein in the urine, whether there is any blood cells in the urine, whether there is any pus in the urine, whether there is any crystals in the urine like uric acid or calcium crystals. We should find out all those things. So one urine test per year is important. And the third important investigation which we all should do is look at the structure, whether the kidney structure is okay or not. Structure is seen by a test called ultrasound scan or sonography or USG abdomen. This is the test which will tell you whether you have two kidneys or one kidney. And trust me, everybody has two kidneys is not the norm. It's not correct. But the real data is every 1,000 child who is born in this earth has only one kidney. This is the data. So among all of us, if we are 1,000 people, one person has only one kidney. If we scan, we will get to know. So this also tells us that this is why the symptoms of kidney failure or the symptoms of kidney problem is detected very late. Even with one kidney, the person is normal. So that means even if 50% of kidney gets damaged, there won't be any symptoms. So by the time symptoms comes, 80-90% kidney has been damaged. Hence this work of prevention. So we have to prevent kidney disease to make India powerful and have a brighter future ahead. So I hope you all remember these 8 golden rules. First is adequate water, adequate hydration. Second is eating fresh food. Third, exercise is important, 30 minutes per day. Fourth, avoiding addictions like soft drinks especially. Fifth, avoiding painkillers. Sixth, controlling blood pressure. Seventh, controlling blood sugars. And eighth, checking your kidney once a year. If you don't teach others, you won't learn. If you know something today, you have to tell someone tomorrow. Otherwise, that knowledge will go. It will go. So it's important to always tell others. Any doubts, any questions, anything you can ask. Any medical question in your mind. Not regarding kidneys, anything also. I know it's hot and summer and it's a unique experience talking in the sun under the trees in the tribal area and in Etunagram. Anything, madam? You can ask. Nothing to. If you want to ask, you can tell my friend's issue. That is the way to hide it.